77 lives lost, 4 countries in shock. In just weeks, a historic wave of lethal heat has swept from Spain to Italy, through the Balkans and into North Africa, shattering records and overwhelming hospitals, care homes, and power grids at every stop. This is not a distant climate warning. It is the most deadly and rapidly spreading heat wave crisis Europe has faced in decades. How did so many systems fail so quickly, and why are the real risks still underestimated? In late June, as Andalusia baked under a relentless sun, the temperature in El Granado soared to 46 degrees Celsius, the highest June reading ever recorded in Spain. Inside a care home on the outskirts of Seville, the air felt thick and unmoving. Staff moved slowly through the corridors, carrying pitchers of water and ice packs, trying to comfort residents who struggled to breathe in the heat. The building's cooling system, designed for milder summers, faltered under the strain. By midday, fans and portable units were running at full power, but the main air conditioning had already failed in several wings. One care home manager, speaking through exhaustion, described the mounting fear as the mercury climbed. With several staff out sick and others unable to reach work due to public transport disruptions, the home was left dangerously understaffed. Family members who called for updates heard only reassurances. Then within 48 hours, 3 elderly residents were found unresponsive in their rooms. Emergency services arrived too late to help. The official cause listed complications from chronic illness, but the timing left little doubt about the role of the heat. The maintenance log, reviewed after the fact, noted repeated requests for repairs to the central cooling unit during the previous spring. Budget constraints had delayed a full replacement, leaving the system vulnerable just as the heat wave arrived. In the days that followed, provisional mortality data from Spain's Carlos III Health Institute showed a sharp spike. 380 heat-attributable deaths across the country in June alone, with the majority occurring during the week from the 21st to the 28th. The data, still awaiting final verification, traced a grim curve that mirrored the rise in temperatures across southern provinces. At the national level, the summer average reached 24.2 degrees Celsius, Spain's hottest on record. For the most vulnerable, especially the elderly confined indoors, the heat wave was not just an inconvenience but a direct threat to survival. The pattern was clear. When infrastructure failed and staffing thinned, the consequences were immediate and deadly. The question of responsibility hung in the air, whether from delayed maintenance, insufficient staffing, or a lack of emergency planning. The system's cracks had become fatal. The crisis in Andalusia was not an isolated event, but the first clear signal that Europe's safety net for its most at-risk citizens was unraveling under extreme heat. On the morning of June 30th, the emergency department at a public hospital in Bologna braced for another day of record-breaking heat. Dr. Lucia Ferri, an emergency room physician with 15 years of experience, scanned the triage board as the waiting area filled beyond capacity. Overnight, the hospital had already treated more than twice the usual number of patients for dehydration, heat exhaustion, and respiratory distress. By midday, the triage team faced a flood of new arrivals, many elderly, some brought in by ambulance from overheated apartments. Others were construction workers and delivery drivers who had collapsed on the job. The hospital's incident log for that day recorded a sharp uptick in heat-related admissions, with staff forced to prioritize only the most acute cases. Cooling fans and intravenous fluids ran low. In the hallway, a nurse administered oxygen to a man in his 60s, his skin flushed and his pulse racing. The emergency department's chief resident later recalled that the sheer volume of cases blurred the usual boundaries between urgent and routine, and every hour someone else was in crisis and it was impossible to keep up. Outside the hospital, the city labor inspectorate documented the fatal consequences of exposure. In San Lazaro de Savana, a 47-year-old construction worker collapsed while pouring concrete under direct sun. Paramedics declared him dead at the scene. Hours later, in Bagaria, a 53-year-old woman suffered a cardiac arrest after walking home from work during the hottest part of the day. Both deaths were officially attributed to heat stress. Istat's provisional daily excess mortality curve for late June traced a steep ascent, with the week from the 27th to July 3rd showing a marked increase above baseline. Emergency admissions for heat-related illness across northern and central Italy mirrored this spike, even as hospitals struggled to maintain staffing levels amid staff illness and exhaustion. For health authorities, the data spelled out a widening crisis. 27 cities, including Florence, Milan, and Rome, remained under heat alerts, with 13 classified as red, indicating maximum health risk. Emergency departments in these regions reported similar surges, and the limits of Italy's medical and labor protection systems became clear. The events of June 30th did not mark the peak, but the system's ability to absorb further shocks was already in doubt. In the fields outside Scala, Messina, the temperature reached 43.2 degrees Celsius as a seasonal agricultural worker began his shift before sunrise. By late morning, the air shimmered with heat, and a haze of wildfire smoke drifted in from the hills. Protective measures were limited to a bottle of water and a baseball cap, no mandated cooling breaks, no shade tents, no on-site medical checks, just a quota to meet and a supervisor's warning not to fall behind. At midday, the worker collapsed, his breathing shallow, his skin hot to the touch. Emergency services arrived too late to revive him. The death was officially attributed to heat stress, but the circumstances pointed to deeper failures. Labor inspectors had flagged the farm for non-compliance with heat protection regulations earlier that month. Enforcement records showed a pattern. Seasonal workers in Greece often lacked access to basic protections despite laws on the books. As wildfires burned across the Peloponnese, the risks multiplied. Smoke thickened the air, making each breath harder, while the relentless sun turned open fields into lethal traps. The loss was not isolated. It exposed a gap between policy and practice, where extreme weather and regulatory neglect intersected, and where the price was paid in human lives. The crisis in Greece, fueled by both heat and fire, now pressed eastward toward the Balkans, where even more fragile systems stood in its path. Shortly after the heat advanced into the Central Balkans, municipal officials in a mid-sized Bosnian town faced a crisis that tested the region's fragile infrastructure. On August 13th, as temperatures hovered between 40 and 42 degrees Celsius, the local transmission system operator's incident log recorded a spike in power demand that outstripped the grid's summer capacity. At 2:17 in the afternoon, voltage sagged across several neighborhoods. Within minutes, automated load-shedding protocols triggered rolling blackouts, leaving thousands without electricity as the afternoon heat intensified. Cooling units in apartment blocks and care facilities stopped. Water pumps faltered, and the local hospital switched to backup generators, rationing air conditioning to emergency wards only. A municipal official speaking on record described the situation as a near miss, not a full system collapse, but a warning sign. The transmission system operator's post-event report later confirmed that grid stress during the peak heat window nearly breached operational safety margins. Civilian surveys documented widespread distress. Residents reported heat exhaustion, spoiled food, and difficulty reaching emergency services as mobile networks buckled under the surge. No official mortality tally was released for the blackout period, but regional excess death data for August showed a marked rise, particularly among the elderly and chronically ill. The incident exposed the region's acute vulnerability to climate-driven demand spikes, revealing a gap between nominal grid capacity and real-world resilience under extreme heat. As the heat wave pressed north and east, the question of how many more systems could withstand such stress remained unanswered. In Casablanca, a community advocate stands outside a crowded neighborhood clinic, her phone filled with unanswered messages. She has been tracking heat-related illnesses for weeks, but when asked for official records, she shakes her head. There are none. Morocco's health ministry has yet to release a verified national registry for 2025. Without this baseline, the full extent of the crisis remains invisible, both to local responders and to international agencies. Urban proxies offer hints. Water use in Marrakesh spiked to unprecedented levels, and ambulance dispatches doubled during the hottest days of July. Yet without formal excess mortality data, every estimate is guesswork. To understand what is missing, consider the Euromomo monitoring system, which aggregates verified excess deaths across 29 European countries. In 2003, the Euromomo curve shot upward, capturing a continent-wide disaster. In 2022, the pattern repeated, with tens of thousands of deaths mapped in near real time. For 2025, the system's continental overlay highlights a stark absence. Morocco is blank, a data void on the southern edge of the crisis. This gap is not just a bureaucratic oversight. Without hard numbers, Morocco's losses are excluded from European benchmarks, policy debates, and emergency funding calculations. The advocates' frustration is echoed by health workers across North Africa who warn that the true death toll may never be known as the heat wave's reach extends beyond Europe's traditional borders. The lack of transparent data leaves a critical blind spot that undermines both local response and global preparedness. Europe's extreme heat waves now exceed the mortality rates of past disasters, surpassing even the death toll from 2003 in several regions. As climate volatility accelerates, infrastructure and policy lag behind. The question is no longer if these crises will return, but whether we adapt fast enough to prevent the next tragedy.